I'm Dr. Christopher Barker, a clinical psychologist licensed in the state of New Jersey, and welcome to Holding Space, or if you are already holding space, welcome back. For those who have any questions or comments, please feel free to leave them, and always feel free to hit like and subscribe and follow more of these. I'm open to any topics that you may want to suggest, and if there's anything that is especially something you're concerned about, we do talk about psychology. We also talk about other things that are a little more outside the box, like the Mandela effect. But one thing that I get frequently is people saying, so, like, what is normal? I don't want to specifically dwell too much on pathology. And actually, that's a really good question. What is normal? Am I normal? Is a variant of that. Yes, most likely you are. Even if there's some disorder that you're struggling with, that also makes you normal, because normal is a statistical word. If the majority of people are doing something, then it is normal. And even if it's something that seems really bizarre, if the majority are doing it, then it is the norm for that group, that population, that country, whatever you have as a population in mind. So if we look at normal as the bell-shaped curve that you'll see in statistics class, this is the mean. This is the average. Most people will fall into this range. These are called standard deviations, and most people will fall into somewhere into this range. And if you're experiencing something that's way outside of normal, that you're having something that's going on over here, then yeah, your behavior, thoughts, questions, whatever, are not normal, but they're not necessarily pathological. Einstein was not normal because he had a better IQ than a lot of people. There are a great many people who are far ahead of the curve, and they are abnormal simply because they don't fit into that shape. Now, there is one thing, oh my gosh, I'm going to be doing this statistics lesson. If your population shifts, and if you're looking at something that has the idea of, okay, so like more people are doing this, and this is the baseline. This is where like everybody basically starts from. If your population is smarter than average, if you're, for instance, talking about your population as being Mensa, then your IQ range would probably be more like this. It's called a skewed distribution. And so some places and sometimes in history, we will have skewed distributions of what is normal behavior. What would be normal behavior in ancient Rome would not be normal behavior in modern New York. And again, that's one definition. Another definition is, are you in any distress? If you are experiencing symptoms of something, if you are experiencing a disorder, if you have an obsessive compulsive issue, if you have an obsessive compulsive disorder, if you have an anxiety disorder, these things put you outside the normal bell-shaped curve, but they don't necessarily make you abnormal. It makes your situation not normal. And that is a difference. To be considered abnormal is, well, pretty much of an insult. Abnormal behavior is anything that is not seen in the majority of cases. That doesn't necessarily mean it's pathological. It's pathological if it's causing distress to others, if it's causing distress to you, if it's part of an identified syndrome, if it's part of an identified disorder. And I think by and large, when we talk about different things like spectrum disorders, that really blows the roof off of anything that might be considered a bell-shaped curve, because some things are going to fall. There it goes back to drawing again. There are going to be some things that are going to be not really part of the standard bell-shaped curve. So again, the majority of people following along this line, if you have a bipolar disorder that is not really part of what one would consider normal bipolar disorder, as in bipolar 1. If you have bipolar 2, if you have childhood onset bipolar, first of all, just by having a bipolar disorder, it can put you somewhere over here. But again, within that, there are several different shades. And anytime you have a spectrum issue, you are falling somewhere along any of these. And again, a spectrum can be huge in that it can cover the whole range, or it can be just a tiny section. And I think there's a sort of a way of looking at this that is people are looking for what's wrong with me. I generally tend to want to stick with what's going right with you and what is healthy and what is considered high functioning for you. And that is what is important. The other stuff is kind of like a problem to be solved or something to be contended with or something to learn to work around. The vast majority of people have some degree of mental health. And I think we have to remember what that is. And we have to remember that you have some degree of mental health also. And that anything that is considered troublesome for you is troublesome for you and may not necessarily be troublesome for someone else. A lot of people have issues that go on inside that they never tell anyone. And a lot of people have obsessions, disorders, ways of looking at things that never see the light of day. So they keep their struggles to themselves. That can be problematic because if you don't tell someone about it, you struggle with it yourself. And sometimes it reaches a point at which you just feel like your head is exploding because you try to keep this all to yourself. Not necessarily something that you want to broadcast to the world, but finding someone to talk about this with, someone to tell the things that you're feeling is really important. You need to be able to find someone who's trusted. If it involves a therapist, great. If it involves a friend, also great. If it's a parent or a significant other, a loved one, if you have a trusting relationship with them, you should be able to tell them about these things. If you can't, then you find someone who is an objective stranger, a therapist, or, sometimes there are crisis lines, sometimes there are hotlines for things, but don't struggle alone. You are somewhere in that bell-shaped curve, and you are normal to some degree. The struggles that you may have may not be what everybody else has, but that doesn't mean that it's necessarily a pathology. You are a human being and you need to be understood, and it's okay to be understood. It's something that we all strive for, and not everybody's able to achieve. Being able to talk to people, being able to relate who you are and get people to understand who you are. Sometimes it's a result of things that you've been through. Sometimes it's a result of things that are biological. Sometimes it's something that's totally outside your control that's happened to you. But in any case, your struggles are your struggles and they are worthy of resolution. You need to be able to feel better about things. So we're going to start with the assumption that you're a normal person, that there's something that you're going through. There's something that you want to address, and that becomes the basis of who to approach. If it's a conflict between people and you can resolve it with the other person, that's terrific. If it's something that you can talk to a parent, a friend, a priest, or rabbi, or who have you, that you feel comfortable with, also good. If you need to talk to a therapist, we're here. If you're having trouble figuring out who to talk to, again, talk to a trusted friend. And if somebody that you approach with your struggle does not know what they can do about it, they might possibly know someone that they can refer you to. This is all just kind of a long-winded way of saying I'd rather look at you as a normal person who has a struggle with something than an abnormal person. I had somebody ask me recently, so like, what's my diagnosis? I'd rather tell you how it's affecting you. I'd rather like break it down systematically. I remember when I was in college and I was taking education courses because I had an education minor. They said you have to operationally define behavior. You don't say to a parent, Johnny is bad. You would say, Johnny is throwing chairs out the window. And that constitutes bad behavior, of course, but it's not a judgment on the person. It's a behavior to be addressed. It's something to change. So define the behavior, define the issue, and break it down so that someone can really understand what's going on with you, because they also are in the normal bell-shaped curve somewhere, and they're also struggling with something. This has been my chance to give you a brief overview of what is considered normal, by me at least, and certainly by a great many of us in society. If you have any questions or comments, please feel free to reply to this and leave a comment at the bottom. There's an email that you can write to and you can ask me questions. And please talk to somebody. I'm holding space for you. Thank you for holding space for me, and I will see you soon. Thanks.